It is estimated that 90% of people suffering from preventable diseases rarely heed to healthy foods consumption.
Nutrients that they need for good childhood development.
Sandrina Wanjiko, a nutritionist, explains the dangers of this course of life, especially among young people.
In the next, say, 20 years, I'm seeing a lot of youths going through obesity, hypertension, even infertility for women. I'm not seeing us getting to the age where our grandfathers got to because of the meals we're taking.
She attributes rampant fast food consumption to easy access of hotel and restaurant services, especially on our phones, a trend that not only worsens the health risk factor, but also promotes laziness.
Suppose you're in the office and you're working an 8 to 5, it's your lunchtime, you only have an hour to spare. You don't even think of a healthy meal to begin with. All you think of is, I'm really hungry, I need a quick fix. At times, healthy meals here in Kenya are more expensive compared to, the unhealthy meals. With 100 shillings, I can go down there and get fries. With 100 shillings, it can be a bit hard to get a healthy meal.
For instance, for patients who suffer from arthritis, one of the steps in their treatment is to get nutritional services, scenarios with which Sandrina is well conversant.
90% of the time, you'll direct them back to traditional African food. You'll tell them, take your half plate of vegetables, for instance, for diabetes. A brief example, take a half plate of vegetables. For your meats, don't go for the deep fried chicken. Just grill your chicken and go for, the lean meat, or remove the skin of the chicken, etc., just to ensure that they're not taking high fat content.
Sandrina warns that the risk of being addicted to such health risk foods begins early in life.
Nowadays, we're seeing lots of even children in the malls asking for things like pizza and their chicken and fries. Try and prepare your meals at home, even the baby's meals. They can be minced, they can be in, a form where it's easily ingestible, or, they can easily digest, even as a child.
Along with diseases such as diabetes, cancer and blood pressure, some occurrences in the body are also contributed to by poor diet without our know-how.
Some of these include acne, for instance. For acne, we've had to tell some of these clients to reduce their sugar intake. And that also includes the overweight and the obese patients, who of course have to be on like a high fiber diet.
One, however, is informed on decisions to make in order to evade the looming lifestyle diseases health crisis.
Try prepare your meals at home. First of all, it's economical, and secondly, it's healthy. And in the next couple of years, you'll actually really appreciate that you prepared your meal at home, that you ate your ugali, skuma, and something else for a protein back at home.
Ben Kerera, K20.